You've probably reached for an ice pack after twisting your ankle or grabbed a heating pad for a sore back. But do you really know when to use heat versus cold? Get it wrong, and you might make your pain worse. Get it right, and these simple therapies become powerful tools for managing pain without medication. I'm breaking down the science behind heat and cold therapy and sharing research-backed techniques from Harvard Medical School experts. Before starting any new pain therapy, talk with your doctor, especially if you have underlying health conditions. How heat works. Let's start with heat therapy. According to Harvard Health, heat raises your pain threshold and relaxes muscles. The goal is to increase tissue temperature by 9 to 12 degrees Fahrenheit. Heat causes your blood vessels to widen, called vasodilation. This increased blood flow brings oxygen and nutrients to the affected area while flushing away inflammatory chemicals that contribute to pain. Harvard researchers explain that moist heat can raise pain thresholds and decrease muscle spasms in people suffering from osteoarthritis. Research shows that heat wraps may reduce back pain and disability. Heat works well for chronic pain, muscle tension, joint stiffness, and conditions like arthritis. Your heat source should never be uncomfortably hot. Exposure to temperatures above 113 degrees Fahrenheit may be painful, and above 122 degrees can burn your skin. How cold works. Cold therapy does the opposite. It causes vasoconstriction, narrowing your blood vessels and reducing blood flow. This might sound bad, but it's exactly what you want for certain types of pain. According to Harvard Health, cold application can decrease inflammation and muscle spasms and may help speed recovery from injury. Cold also numbs nerve endings, reducing pain signals to your brain. A comprehensive analysis of 32 studies involving over 1,000 patients found that cold therapy applied within 1 hour after exercise effectively reduced pain from delayed onset muscle soreness within 24 hours. Cold water immersion showed particularly strong effects. Cold is best for acute injuries where you have swelling, redness, and inflammation. It's also effective for migraines, post-surgical recovery, and conditions that cause sudden flare-ups like gout or tendinitis. When to use cold? The first 48 hours. Here's the golden rule. For acute injuries, reach for cold first. If you've sprained your ankle, pulled a muscle, or bumped your knee, you want cold therapy. Harvard Health recommends applying cold for no more than 20 minutes at a time, 4 to 8 times a day for the first 2 days after an injury. This is when swelling and inflammation peak, and cold is most effective. Standard therapy for injuries follows the Price technique: protection, rest, ice, compression, and elevation. Here's how to do it safely. Use a store-bought cold pack, a bag of frozen vegetables, or ice cubes in a sealed plastic bag. Never put ice directly on your skin. Always wrap it in a towel first to avoid tissue damage or frostbite. Don't use cold therapy on stiff muscles or joints, or if you have poor circulation. When to use heat? Chronic pain and stiffness. Once the acute phase has passed, usually within a couple of days, switch to heat. Heat becomes your therapy for chronic pain and muscle stiffness. Harvard Health notes that applying a warm, moist towel to a sore joint or taking a warm shower can temporarily relieve pain. Research shows that hot pack therapy was most effective for pain relief, particularly for muscle soreness. Studies found hot packs significantly reduced pain both within 24 hours and beyond 48 hours after exercise. For back pain, Harvard experts note there's more support for using heat because muscle tightness tends to be the main issue. Heat relaxes tight muscle fibers. Here's a tip from Harvard research. Moist compresses are more efficient in transferring heat than dry electric heating pads. At home, put a moist towel in a plastic bag to make the heat last longer. Apply heat for 15 to 20 minutes at a time, and never place heat directly on your skin. Combination therapy and safety warnings. Research suggests combining heat and cold therapy may be effective for certain conditions. Studies indicate that using both together can relieve low back pain with fewer side effects than medication alone. This approach, called contrast therapy, alternates between hot and cold. Athletes use contrast water therapy for recovery. Know the safety warnings. Heat therapy should not be used on acute injuries or active inflammation, as it can worsen swelling. Cold shouldn't be used if you have circulation problems or on stiff areas. People with certain medical conditions need extra caution. If you have diabetes, poor circulation, heart disease, multiple sclerosis, rheumatoid arthritis, or sensory disorders, talk with your doctor before using heat or cold therapy. These conditions affect how you sense temperature, putting you at risk for burns or tissue damage. Pregnant women should consult their healthcare provider before using heat therapy, particularly for the abdomen or lower back. Never fall asleep with a heating pad on. Heat and cold therapy are simple, safe, and effective tools for pain management when used correctly. The basic rule: cold for new injuries and inflammation, heat for chronic pain and stiffness. These therapies tap into your body's natural healing mechanisms. Cold reduces inflammation and numbs pain. Heat increases blood flow and relaxes tense muscles. Both help you manage pain without immediately reaching for medication. These are guidelines, not a substitute for professional medical advice. Before trying heat or cold therapy for the first time, especially if you have ongoing health conditions or concerns about a specific injury, talk with your doctor or healthcare provider. They can help you determine the safest approach for your situation. If this video helped you understand heat and cold therapy better, hit that like button. Want more evidence-based health tips? Subscribe and turn on notifications. Drop a comment. Have you used heat or cold therapy? What worked for you? Thanks for watching, and here's to finding natural relief from pain.